Welcome to This Week Health Community. My name is Bill Russell. I'm a former CIO for a 16-hospital system and creator of This Week Health, a set of channels dedicated to keeping health IT staff current and engaged. Today, we have an interview in action from the 2023 fall conferences of Chime in San Antonio and Health in Las Vegas. And we want to thank our show sponsors who are investing in our mission to develop the next generation of health leaders. And they are Olive, Rubric, Trellix, Medigate, and F5. Check them out at thisweekhealth.com. And here we go. We're sorry that the audio on this episode is not top quality. We did our best to try to make this as clear as possible. Sometimes the microphones don't pick up what we hope they will pick up in the crowded showroom floor. And so we made some modifications and tried to accentuate the audio as best as possible. If you miss anything, don't worry. You can check out the transcript in the episode page linked in the description of today's episode. Thanks for listening. All right, here we are for another interview in action. We're here from the Health 2022 conference in Las Vegas. And I'm going to ask you guys to introduce yourself.
I'm Dedi Gilad, founder and CEO of TytoCare, very innovative digital health and primary care.
Monique Reese, I'm Senior Vice President for Home Care for Highmark Health, healthcare.
All right, so we're going to talk home care and really the gap between just basic telehealth and what could be possible. So tell us a little bit about TytoCare.
Sure. So Tyto started roughly 10 years ago, and we evolved with the industry. And today, actually last week, we launched with a big announcement around the new offering of a home smart clinic, which actually, as what you just said, solving the home delivery gap, I would say, of traditional virtual care or telehealth by bringing for the first time a holistic view around the family, not a specific patient, not pediatric, not adult, not chronic patient, but the entire family, both to do urgent care, primary care, longitudinal care for chronic disease management, and even preventive care. So we are doing all of those within one platform, powered by a very unique kit, home device, a kit that enables the patients for the first time, consumers, members, patients, to do a full virtual visit from home, replicating the clinical side of it. So auscultation of the lungs, the heart, imaging of the throat, the ear, everything together with those programs that we bring on the software side, and really allow people to consume and to look for primary care for home in a much more effective way.
Highmark. So, I mean, you're multi-state, right?
Yep, so we're a national healthcare company.
National. I learned something on every show, so it's fantastic. How's Highmark looking at
You know, we're really grounded in our living health strategy. And part of that living health strategy is helping to redesign the insurance product and at the same time partner to redesign the healthcare system. So our partnership with TytoCare is really around bringing in different technological companies to help us actually do that. So we're in partnership with TytoCare in regards to those capabilities from a primary care and home standpoint. It's a very important initiative of ours and part of our overall living health strategy.
So it's, I mean, you talk about living with chronic conditions. You talk about primary care. You talk about urgent care. I mean, explain a little bit more about how this all works. I know it's a platform, but there's devices involved that also help you live with your chronic conditions.
Yeah, that can help you do everything from consuming. When we say urgent care, we see the primary care journey with three levels. You can still and should, when needed, go to a physical brick and mortar clinic, hospital, urgent care, ER if needed. You want more and more to transfer or to convert some of those interactions to virtual. So if it's 10 p.m. at night or the weekend and there's an urgency to see a doctor, this is where urgent care is coming in, virtual urgent care. Tyto support that a lot, reducing the need to go unnecessarily to the urgent care or to the ER and getting the first line of treatment with clinicians from Highmark, from their health system, or from physicians that are supporting their network. But you can also do general primary care on your day-to-day with your PCP Tyto allows a very easy communication with your own physician. You don't have to go to a doctor in the cloud specifically. You can also share data and connect with your own physician in the community and have a continuity of care during your life. So we really support all the use cases, all the way from the urgent care at night to the ongoing work on primary care and even chronic conditions.
So if I am thinking population, I assume, how are you?
So I think there's a couple things. I think if we look at this from a benefit design standpoint, you first have to have within your benefit design to pay for those type of services. So one would be how we design different products to ensure that we have the ability for member, patients, families to have access to those virtual capabilities. I think the second piece is as we develop out solutions that are more in the home environment, the technology, the software becomes extremely important to create, I would say, that convenience. But I'd also say if you line up to the consumerism in healthcare, it's another modality to kind of meet the demands of creating a more remarkable experience. Less windshield time, less travel, more real time. So TytoCare is partnering with us in order to be able to deliver those capabilities in the individual's home.
So as an employer, I wouldn't really think of it as an employer. This could be a benefit, especially given the
well, the convenience. So if you think about individuals and the time they miss work to go to a primary care clinic from a virtual or from a bricks and mortar standpoint, it's night and day.
I would like to maybe emphasize on that question is that today, even more important than ever, certainly when you look at the post-COVID and the economic situation, is that beyond the basic and obviously convenient and great medical service remotely is key, but there are other KPIs that specifically Highmark are looking very strongly with the ASO market, with their own full insured population, with Medicaid. It's also around ROI and in terms of value-based care and how can they really make an impact. Those savings of time to consumers and getting the best clinical outcome from home also reduces the cost on the system, reduces the need for more clinicians. You can do much more with less. And we are seeing today and showing today, we're just starting the journey with Highmark recently, but we see some great results that we also announced around total cost of care reduction. So a health system that take value-based contract or looking at Medicaid population or health plans can see really an ROI benefit as well on the total cost of care.
All right, we'll get back to our show in just a minute. We have a webinar coming up on December 7th, and I'm looking forward to that webinar. It is on how to modernize the data platform within healthcare, the modern data platform within healthcare, and I'm really looking forward to the conversation. We just recorded 5 pre-episodes for that, and so they're going to air on Tuesday and Thursdays leading up to the episode, and we have a great conversation about the different aspects, different use cases around the modern data platform and how agility becomes so key and data quality and all those things. So great conversation, looking forward to that. Wednesday, December 7th at 1 o'clock. Love to have you join us. We're going to have health system leaders from Memorial Care and others. CDW is going to have some of their experts on the show as well. So check that out. You can go to our website, thisweekhealth.com. Top right-hand corner, you'll see the upcoming webinars. Love to have you be a part of it. If you have a question coming into it, one of the things we do is we collect the questions in the sign-up form because we want to make sure that we incorporate that into the discussion. So hope to see you there. Now back to the show.
So Medicare Advantage population. Talk to me about the providers. So you have provided 10 years that used to give some provider partnerships.
Yeah, we have a titles strategy. And we are, as a concept, provider agnostic. I think this is part of our uniqueness. We do not come in with our own provider group. I think at the end of the day, a member or a patient wants to be able to consume healthcare the way they choose. It's part of the trust, it's part of the psychology side of it. And for example, with Highmark, you can go in the urgent care side to a doctor in the cloud at night, but you can also utilize they have an affiliated clinicians group a large health system and they own a large health system within them. So we can serve with those kind of clinicians, and we can serve with the general telehealth clinicians as well. We can also allow consumers or members to even share data and connect with their own PCP. So you can roll all the way and really have the democracy as a consumer. Who do you want to work with? And Tyto is really easily integrated to all of those modalities.
How important is that in the benefit design of the state, where I have a trusted care provider in the market, and I know that doctor, how important is it?
It's extremely important. I would say the ability to choose is extremely important, and affordability, I think, is where you were going, was the ability to make healthcare more affordable. And so I would say they're both very important.
So we talk about ROI, we talk about the financials. If all we talk about reducing the cost of care, that could probably be enough. Are there other outcomes we're seeing as a result of utilizing this?
On my end, I think, and this is something that Highmark is highly interested in, is how to take new digital programs in a little bit of a different approach in terms of defining the right cohort, doing engagement. Tyto is investing a lot into engagement capabilities and how do you really make those programs successful. So it's not enough to give great technology at an affordable price to consumers. You have to make sure that people are aware there is a behavioral change, certainly with technology like Tyto. You can see post-COVID, let's be honest, there was a reduction in utilization and traffic to those virtual services. During COVID, there was no other choice, so people used it a lot. But today you have to make people engage and understand and aware that this can really to shift their behavior out to a certain degree, and we're investing a lot into that.
So adoption is
key element.
Yeah, but it's a challenge. I mean, you're putting this technology in people's homes. You don't have elbow support. You don't have those things. Are these devices that simple? Engagement is that simple?
Yes, but of course, it was built for families to be consumed in a very, very easy way, and we track everything. So Highmark and our partners can define a journey that says, okay, this is now the winter time, we want to educate, we want to promote more awareness to this disease. There's a new COVID wave coming in, we want to be aware of that. There's a newborn in the family. There are things within a family journey that you can engage on. So having the technology and easy enough to use, that's one. But healthcare, you don't wake up in the morning and just consume healthcare. You need to be aware that when you need it, it's there. So this is part of our engagement programs, and we build it and customize it with our partners like Highmark to the right population. So it might be a little bit different on commercial fully insured, might be a little bit different on Medicaid, but it's generally the same concept of those engagement programs.
What are you looking for in terms of outcomes?
We're looking to have care be more affordable. We're looking to create a better experience. I think bringing offerings from a product standpoint that has innovation like TytoCare embedded and ingrained in it becomes important because that's part of the benefit that an individual has. And I think creating our marketing experience is part of the pieces that are grounded in
Experience. We're hearing that a lot.
Yeah.
In this conference. So, fantastic. Thank you for your time. Appreciate it.
Thank you so much.
Another great interview. I want to thank everybody who spent time with us at the conferences. I love hearing from people on the front lines, and it is phenomenal that they have taken the time to share their wisdom and experience with the community, which is greatly appreciated. We also want to thank our channel sponsors one more time who invest in our mission to develop the next generation of health leaders. They are Olive, Rubric, Trellix, Medigate, and F5. Thanks for listening. That's all for now.